You've probably seen this here before, but this is the line chart showing the data exactly as it is presented on the two ONS, Office of National Statistics, tables that were released in 2022 and most recently updated August 25th, 2023. And here you've got the all-cause death, age standardized mortality rate per 100,000 person years for the whole adult population of England, ages 18 to 90 plus, divided by how many shots populations got. So here, this dark blue line, this is the zero shots population. And consistent, this is January 2021 when the data opens up. The CDC told us back in July of 2021 that they were observing a strong healthy vaccinee effect. What's that mean? It means that the people who got the shots were fundamentally different overall, in general, on average, from the population that didn't get any shots. Now, in the earliest months, you wouldn't expect that to be such a strong difference because, of course, some people who hadn't gotten any shots in January, February, March, or April were perhaps perfectly willing to go get the shots and would get the shots in some later months here. But there is, of course, the hardcore of the people who got zero shots who never left this cohort because they'd never got any shots. And I'm saying that by about February 2022, maybe even January 2022, the doors were closed. And that nobody who hadn't gotten any shots by this time was going to start getting shots. You tell me if you have a different view on that. So back here in these early months, I suspect a lot of these people were dropping into the one-shot group. And of course, you can't get into the two-shot group without coming out of the one-shot group. And you can't get into the three-shot group without coming out of the two-shot group. And you can't get into the four-shot group without coming out of the three-shot group. And so this is very nice because you have 28 months of data from the beginning of this experiment to May 31, 2023. And you have it divided. By the way, all these shots are 21 or more days ago. So this helps us avoid some of the confusion where people would say, if somebody died 13 days after getting a shot, well, he was unvaccinated, because the shots don't work until 21 days or 14 days after. This doesn't subject us to any of that stupidity. These are populations each month that have gotten the stated number of shots at least 21 days ago. Interestingly, the one-shot cohort and the two-shot cohorts start out with substantially lower all-cause death, age standardized mortality rates than their peers getting zero shots. Now, when I say age standardized, that helps us evade some other stupid objections, like people saying, well, you can't compare the 80-year-olds who got shots to the 30-year-olds who didn't get shots. Of course, the 80-year-olds have a higher death rate. Age standardization compares like to like. That's what the standardization is. And this isn't my idea. It's how the ONS presents the data, and they use the age standardization model that's dictated by the World Health Organization. And let me just tell you that if these data were crude death rates and not age standardized, it would look a lot worse. How do I know that? Because the ONS tables actually give you the person years in a cohort each month, and they also give you the count, the raw count of deaths in that cohort in that month. And using those two numbers, you can find out the rate of straight up deaths per 100,000 person years in that cohort. And those numbers are way higher, especially in these groups that got shots. So we're going to stick with the way ONS presents it, using the World Health Organization standardization model. And every single number here is taken directly from that table. All I did was put it into a line chart so you can look at it easier. There's no math, there's no calculation, there's no analysis performed by myself. So back to this data. And let's recall again that healthy vaccinee effect. And let's recall that the CDC told us in July of 2021 that adults who had gotten 2 mRNA injections had a 1/3 non-COVID death rate compared to their peers who'd gotten 0 shots. In other words, going into this experiment, and even by July of 2021, people gotten 2 shots in America had a 1/3 non-COVID death rate of the unvaccinated. Well, here we are in July 2021, and this is for all England, not the United States. And those who'd gotten 2 of these shots, there's this unfortunate spike up here, but you can see for a while they had a much lower all-cause death rate. Now, I'm saying all-cause when I look at this ONS data, and I just said non-COVID death rate when I talked about the CDC data. I'm here to tell you they're basically the same. How's that? Because let's think of 3 death rates. An all-cause death rate, that's just every body bag. We don't care how it got there. A COVID-19 death rate is, out of all those body bags, the ones that died of COVID. And if we take all the people who died and subtract out the ones who died of COVID, what's left is the non-COVID death rate. And again, I'm here to tell you that both in the United States and in England, the portion of all the people who died from all causes, who died from COVID, is a sliver. It's less than 1%. So yes, the non-COVID death rate is different from the all-cause death rate, but by almost nothing. Anyway, I think all-cause is better because this, of course, takes into account dying from COVID and everything else. So we can find out who was the real killer. Was it COVID, or was it safe and effective injections? And keeping in mind that healthy vaccine effect revealed something that we should know about this unvaccinated 0 shots cohort. This includes mostly the smokers, the unemployed, the people of color, the people with low access to health care, the people who engage in high-risk behaviors, the people who don't go check with their doctors or get their teeth checked. That's why going into this, these are the kind of people who just inherently had a much higher all-cause death rate. And surely COVID might have been ravaging them here in these first months of 2021. But that's the population you can look at to say, if no one had gotten any shots, their path would have probably looked like this or even better. And indeed, I think that's what this 4 shots cohort is showing us. These are the few, and they are the few, by the way. They are a minority of all the whole got shots team. So if we take the whole got 4 shots, got 3 shots, got 2 shots, got 1 shots, these 3 groups together are about 55% of the whole got shots population, whereas the 4th shot cohort is about 45%. So they're the plurality by far. But the reason I mention that is because if you take the weighted average by person years of the 4, 3, 2, and 1 shots for each of these months, you get a chart that I've shown you in other videos where the 0 shots people end the experiment with a lower all-cause death rate than the people who got shots. I know I'm jumping around a lot. You can see, though, you don't even need me to tell you what's going on here. As people fall into these getting any shots cohorts, and they never come back, do they? At least not till the end of this data. Now it looks like things are starting to cool off here, but of course we'd love to see how this chart goes off into the sunset. And we're now, is it 10 months? Maybe not quite 10 months. We got a lot of months here that we could see some data for. So of course we hope that gets released. But I ask you in the audience, do you have a supposition about what else could be causing these all-cause death rates of people who start getting these extra shots to just go from lower all-cause death rates than the people getting zero shots to higher all-cause death rates than the people getting no shots, until by the end, the people who got 4 shots after going through this little holocaust here did end the experiment with a lower all-cause death rate than the people who got 0 shots. But the majority of the whole population that got any shots consists of people who got 1, 2, or 3 shots, and they all end this experiment and go for a year or more with a higher all-cause death rate than their peers who got 0 shots. Oh my God.